Yeah, I think early intervention has quite a unique outlook on medication in that the people that we see will never have had medication of that sort before. And that is potentially quite a strong medication with some unpleasant side effects. So we tend to go quite slowly, both in terms of introducing it to the person that we're seeing as an option, one of our treatment options of all the, as part of all the treatments that we provide. And we also tend to, when people have agreed to start using medication, to start slowly on dose and go slowly with taking the doses up so that we can monitor how it's affecting somebody and make sure that it's not an unpleasant experience for the person that we're asking to take it. We tend to use, so I mean, obviously antipsychotics, the family of medications are called antipsychotics. There are lots that have been produced over the years. They're all still quite crude in my opinion, although the more recent ones have less side effects or slightly different side effects than the older ones. So we tend to be guided by NICE, which is the National Institute of Clinical Excellence, which will produce a document that takes into account all the research and all the evidence and then recommend to clinicians what should be used as frontline treatment. So from that we take what's called the second generation antipsychotics, which have come out in the last 10 to 15 years and so well established now as part of our treatment. And then we have within that group about 4 or 5 main ones that we will offer people, and in offering people we will talk through what the medication is, what doses we're likely to use, how it might make them feel apart from hopefully relieving the symptoms, so what the side effects are. And we pretty much ask the person we're asking to take the medication to choose which one they want based pretty much on the side effects. And that can include kind of increased weight or sleepiness or feeling slightly agitated or anxious. So we want to make sure that the person we're asking to take the medication is happy, that they know that what is they're going to feel like once they're on it, so that it's not a surprise, and so they feel comfortable hopefully and confident in continuing on that medication. Yeah, so the side effects are huge in psychiatry and antipsychotics. So they are unpleasant, and there's no trying to hide that from people. It's pointless trying to gloss over that, because they will feel them, and then they will then decide that they're not taking it because they haven't been told that they're going to feel. So we are very upfront about the side effects, and so as I said, so it can be weight gain, there can be kind of changes in your blood levels of cholesterol and lipids and fats and so on, which can cause long term can cause things like diabetes or other circulatory difficulties. They can make people feel sleepy, which obviously if they want to get on and work or they're trying to function normally, that can be a big hindrance. People tell me that they can make them feel numb, mentally numb, and they lose the ability to kind of interact in any meaningful way. So those are some of the more obvious ones. I mean, there's rashes, there's constipation, there's all sorts of, the list is as long as your arm, as there are with any medication. Those are the ones that generally happen, and what we do is we A, tell people they're likely to feel like that, B, check how they actually feel to see whether what we've expecting to see is what they're getting or if it's something different. And it's, everyone's different. Some people get no side effects at all. Some people get everyone listed in the book. And you have to take that seriously. You have to listen to that, because you want the person to be comfortable on their medication and to continue taking it so they get the best benefit. And then once we've identified, and there are some rating scales we can use to look at some of those, to see how severe some of those side effects are. And once those are identified, then you can start to look at ways to manage those. We do comprehensive physical health checks on everybody to check things like their bloods, blood pressure, pulse, their weight, and in particular their circumference around the waist, to see if they put any weight on in areas that we know are indicators for bad physical health. So we do some checking. And then we have advice we can give around weight management, although that's more difficult perhaps to maintain than others, but in terms of healthy eating and not snacking and things to snack on, activity groups we run as well. The sleepiness, there are various things you can do. You tell people to take the medication at night, so that when the sleepiness happens, it happens generally when they're asleep. So we try and tailor the advice we give to what side effects they are having. And most people, when they know all the facts, they know how they're going to feel, and then they do actually feel like that when they take the medication, will continue because they kind of knew it was coming. Sometimes the side effects are so unpleasant and unbearable that they will stop, and that's fine. And we will actively help people to stop, because all the evidence and all the practical evidence that we see is that people will lie to you and tell you they're not taking it, which is no good for us and it's no good for them. So we'd much rather have an open discussion about medication, and it does actually help people continue with medication that can be unpleasant to take. The benefits of medication, and this is disputed amongst people that take them, but essentially as a clinician, we're looking to see a reduction in symptoms so that people can bring themselves to a place where they can talk about how they feel more openly, they can be a bit more objective about what's going on for them. Often when people are very acutely unwell, things are so chaotic and so distressing that they're unable to really sit down and talk about how they feel, what's going through their mind, what's worrying them. So a key part of medication initially is to allow people to come down and bring them down to that point where they're able then to talk about how they feel. And that's crucial really, because the talking is as helpful as the medication, obviously, as we know. And without that, it's very difficult for us to make an assessment. It's very difficult to get started in treatment programs. So that's one of the main benefits. As time goes on and people continue on a dose they're comfortable with and they're happy with, we'd expect to see the symptoms kind of reside completely. People say they're often, it's interesting, they don't disappear, they're often there and they think the same thoughts, but they're just not as bothersome. They don't bother them so much, and they don't find that they're dwelling on unpleasant thoughts. They may have an unpleasant or sort of paranoid thought, but they can just move on and dismiss it. So that's what we're looking for longer term. And the aim ultimately with all of our treatments and early intervention is to allow people to get to a place where they can resume picking up where their life kind of abruptly kind of stopped for a lot of people, and with as little interference from side effects and so on as possible. We've got to be careful about how long we keep people on medications, because there are physical implications, we know that now. So as well as physical monitoring, we do need to be careful of that people aren't on them for too long and then develop other physical complications that are harder to treat and then give them another problem to deal with. So it's a fine balance, and we often ask people to guide us about how long they should be on medication, when do they feel able to come off. And there's literature coming out now that's saying that maybe people should just take medication for the period they're acutely unwell, and then through discussion with their clinicians, stop, come off it, and then reintroduce it if it starts to come back. So we're still experimenting. It's really not a clear-cut one way of treating people. Everyone's different. I often talk with the people I meet about cost benefit, and that's a big one. So is the cost of taking a medication, whether it's the idea of taking medication or the physical feeling that medication gives them, is that more than the benefit the medication gives them in terms of allowing them to function? And if they find that it is, then I'm quite happy to discuss with them about stopping or looking at another medication. Often they will say the benefit of being well and being able to function is worth putting up with some side effects and putting up with some unpleasant parts of the medication. But that's a key discussion, because if you're taking the medication, you want to know that what it's doing is worth suffering some way in terms of side effects. think it's really important with any aspect of medication that you have someone that you can talk to about your medication openly and freely with. So that involves having a prescriber that you have some trust in and that you have a good relationship with. I would go so far as to say if you don't, then you need to ask for another prescriber, because I think with an issue as important as medication that someone's asking you to take and take for potentially quite a long period of time, you need to have trust and belief in the person that's giving you that advice. So that's the first point. Secondly, once you have that, then any discussions around medication should be a two-way thing with your prescriber. Any questions you have, you should be given time to ask them, and you should be happy with the answers. It would be helpful to get written information about those answers as well. If you find it difficult, there's a lot of information given in our sessions sometimes. Sometimes people go away and not feel they've taken everything away with them. So written information or information about the drugs you're taking. In particular, stopping, some medications can last longer in the body than others, so you need someone who's an expert in that field to let you know about whether you can stop suddenly or whether you need to stop gradually over a period of time. But I guess the bigger point is to have somebody that you feel comfortable talking honestly about medication, and that will ultimately help the person get on board with the medication side of the therapy, and also allow the clinician to make good judgment in future treatment planning, because you feel like you're getting, you both have an honest kind of relationship and discussions.